this is not interesting. This is actually important. This is the kind of video that you send to people you love. Today being on a Friday, Taifa Leo has published the front page saying Mulo wa sumu. That report from KNPM, it says, it's Kenya Nutrient Profile Model. It says that out of 10 people that die in Kenya each day, 4 are caused by diseases that are haziwezi ambukizwa kutoka kwa mtu mwingine hadi mwingine. Those are cancer, diabetes and pressure. Tuweke cancer kando, tutaongelea. But diabetes and pressure are diseases that are caused by lifestyle. Lifestyle ni kumaanisha kitu yenye unakula na venye unaishi. So on Tuesday, I had a conversation with Professor Grace. She's on a mission to educate people about diabetes and pressure. I want you to listen to this conversation. Send it to people that you love. The conversation starts slow, but she goes into detail about diabetes. Venye it costs you kuangalia diabetes in 3 years. It costs you, how it costs you ukishapata diabetes na diabetes ikiguza kidney. Kumbuka ukishaanza dawa za diabetes, hiyo ni until lifetime. Na kila dawa inakuanga na side effect kwa mwili. So, it's for a given time, hizo dawa zianze kuaffect mwili yako. Now, this is the kind of video I'm telling you. Tunafaa kujiangalia na lifestyle yetu. So, listen to it kutoka mwanzo hadi mwisho. If you find it helpful, send it to someone that you love, because this is interesting. Send it to someone. This is important. Send it to someone that you love. Send it to your family and friends. Until then, let's check our body. Let's eat healthy, because hebu niambia sasa mimi ni kijana, mimi na hustle. Pia nimepatiana hapo hivyo, kwa hiyo ni nini tuliongea naye nikaingia stories za mzae. Mimi ni kijana, mimi na hustle. Hebu niambia hustle ikianza kujipa, ati sasa ile nafaa kuwa nikikula vizuri na kula vitu mzuri. Ati sasa hiyo ndo naanza kufikiria ati pesa yangu nachukua napelekea daktari. Hiyo it makes sense at all. Sisi ni vijana, na kama wewe si kijana pia, wewe ni mse una hustle, na ukipata do unaelekea ukule vizuri, si pesa yako upeleke kwa daktari. So tujiangalie health yetu na lifestyle. It only takes 21 days for the body to adapt to something. So check out this video, and then I'll be on a mission with her on this one. Because if it's a lifestyle, then we can prevent diabetes and fight diabetes in our country and county. So check it. Tunaongea kizungu, so don't worry. Siku hizi nimekuwa mnoma na kizungu. Adios man. So let me start even with my introduction. I'm Michael Kimani. I'm in my mid-20s, the 25 years. Na I'm a filmmaker. Nimedetea horo wa guthondeka movie. Yeah, so that's me. No goal here or introducing.
Well, thank you, Michael.
Yeah.
Nijitawo Grace Irimu. I'm a professor of health systems and quality care. I teach at the University of Nairobi in the Department of Pediatrics and Child Health. Na goro de kidney specialist. Na goro de researcher. I'm a health system researcher. I'm also an implementation scientist, so I implement programs scientifically. And I'm the clinical director at Mwangaza Wellness and Medical Center, a center which I'm very passionate about to do its specifically diabetes, hypertension. We only see diabetes and hypertension. Because to area work na duanyere to kick diabetes and hypertension out. Can we actually control? You know, right now it's control. The two diseases are controlling us, but we can control them together if you all work together.
Itana igira diabetes imele. Why did you start the Mwangaza Institute Center?
Oh, thank you.
Yeah.
I've been a researcher, and sometime back last year, British Medical Journal, one of the leading journals in UK, asked me to write an editorial, which was one of the greatest honors I've had as an author of many of papers. Now, they had asked me to comment about child mortality in the world. So I had to read a lot kumenya why country X has got higher than country Z. And then I found we are not doing well in Kenya compared na countries shingi cia East Africa. And I have really invested my time in improving care ya ciana. So that affected me a lot actually. Na ngirealize nondu uria ndakiandikaga, what we missed was a community approach, because we focused, at least for what I was doing, we focused so much on secondary level newborn units in the county hospitals or sub-county hospitals. But if you are going to change and to achieve the SDG, the country must focus on primary health care, focusing on secondary level newborn, secondary level care, focusing on tertiary, focus a lot in the sub-county hospitals, focusing in the county hospitals, in the referral centers, in the referral facilities. It will not change make us get the SDGs of the mortality rate. What will help us achieve primary health care. And primary health care, I also including the community health care. That must be their community-based approaches. That is the countries that succeeded in health. They started with community health approaches, or even now they have community-based approach. And primary health care, prevention. When we talk of primary health care in our country, we are talking about dispensaries and health centers. So community health promoters, community, the health workers in dispensaries, in health centers, those are the ones who can actually make us achieve the goals. Todo, when we do not prevent illnesses, they will have so many people going for admissions. But we know we can prevent the admissions so that we reserve the hospitals for the non-preventable illnesses. Right now, like in Nyeri Hospital, with one of the papers which was published, 60% of the admissions were due to non-communicable diseases. And those, number of them, they are preventable with early diagnosis. The problem is we diagnose very late, we don't use the right test, even for hypertension, for diabetes, even for cancer, we are diagnosing diseases very late. So we are overwhelming the secondary level care units, that's the county hospitals and the tertiary care. We are overwhelming them, and then their resources now are also not that very good to do. The patients go there when they are very late. And then because they are being overwhelmed, the care cannot be as good as it would have been. What we need is very good foundation ya primary health care. Niko tuhote kunyihia diseases. Na niko tuhote kusupport our tertiary care. Tertiary care is also very, very expensive. So when we let everybody go to tertiary care, when we don't prevent, it becomes very, very tricky. And that is what other countries, the high developed countries, people are even brought the preventive care in your house. Like
for real.
For real. Like a stool container to look for colon cancer, stool, because they check Mariah stool whether it has blood. They bring it to your house.
Whoa.
Yes, so we need to invest in primary health care. Now, if I can just say, take example ya diabetes. If you're going to prevent diabetes, you just need few tests which will cost maybe 5,000 for 3 years. 5,000. To issue again a diet, which you are still going to. The diet you eat, healthy diet is even cheaper than the unhealthy diet.
Sure.
So it's cheaper. So about maybe 6,000 will be enough for your test. And even in the ones where they are charging more, 10,000 will be enough for 3 years, will be okay. Now, if that person is going to get diabetes and we treat diabetes, there's another paper which had been done, but that was in 2024 there. They had calculated and they said muda was medicated about 70,000-80,000 there. in fact about 100,000 mundu uratumira dawa cia cukari, about 100,000 a year. Now if the kidneys nĩ ihutĩtio nĩ mũrimũ ũcio, we spend like maybe even 300,000. Kũhutio not stage ya dialysis. Ũrĩa ũranyua dawa cia kũgirĩrĩria mũrimũ wa kidney ũthiĩ zaidi. Ũranyua dawa cia cukari na nĩũnyua dawa cia kũgirĩrĩria kidney itigathũke zaidi. It comes to about maybe 300,000-500,000 kũringana na kũrĩa ũrathiĩ. Angĩkorwo you are going through dialysis, okay, SHA is paying for dialysis, so people might not feel it, but the government is using money. We are using the money as a country. It will cost somebody about 1.2 million because of dialysis. So what we are saying, and sometimes now for those people who are going through dialysis, then you look at kana mundu ni productive. Ukona sometimes, depending on how it's done, mundu ndangĩhota gũcoka wĩra hihi ũrĩa arutaga. Depending on how it's done. Ideally, one is supposed to become healthy again and wekera gathuti yaku no gathi ofici and do your normal things. But sometimes, you have to have a caretaker, but that is now poor dialysis. So what I'm trying to say is that prevention, we say they will cost maybe maximum of 10,000 in 3 years. In 3 years. Now, if you are going for treatment, we say there's about 100,000. So in 3 years, that is about 300,000.
Yeah.
If you are taking drugs cia kũgirĩrĩria mũrimũ wa kidney ũthiĩ zaidi, that will be about maybe 1.5 million. That is very low cost, the ones I'm talking about. Now in 3 years time, angĩkorwo nĩ ũrathiĩ dialysis, about 5M. So what we are saying is that we cannot survive as a country without preventive care. No, it's not possible. And then now because uko dialysis, si nyingi uko na complications, si nyingi andũ nĩmanyitire stroke, nĩmatwĩkire brain, there'll be need to train people who are highly specialized. So that's another thing. Well, actually prevention needs a community health worker or nurses and clinical officers.
Wow.
That is what I would like to stand at the top of Mount Kenya and talk about it. I'm a professor of health systems, so I deal with health systems. Yeah.
I see. Okay. Hey, can you go deeper into that about preventive? How one, because that is mind blowing. My father died of diabetes. It was diabetes type 2. Is it? We call it type 2. Ile ya kupanda. Ya sukari wako but.
Yes.
But by the time he was resting, alikuwa imechange kakuwa sasa diabetes hii ingine ya kushuka. In fact, ilishuka and then now it was not normal, and then the kidney ilikuwa imeguzwa. If we can prevent that, because mom keeps talking about taking care, preventing, because now we know it's possible. He always talks about preventing, and if it's that cheap to prevent diabetes, it's 10,000 in 3 years.
And those are just for the test. The diet is even cheaper.
The diet is even cheaper.
Yeah.
Can you talk to us about the diet in Nadauku Hanini?
Diet. The Kenya bigi horo wa cholesterol, tondu cholesterol ni enemy ya diabetes. Kogo, we must keep our cholesterol down. Cholesterol area, when we say cholesterol is the fats in the blood. And the cholesterol area in the blood, you made 20% of it iri cholesterol. Akonta matumbeni iriaini, just 20% of it. Kwana nionega kuria 80% uguthondeka mwiri-ini waku. Koguo it might not even change. Na nikio tene tweraga matikale matumbe, no riu turamera marie one egg a day is healthy. It's healthy.
Or one
egg a day. It has been proven igiragiria heart attack.
Okay.
Before one egg.
The means of cooking, does it matter?
Doesn't matter much.
It doesn't, all right.
But agiko ni boiled kana iri scrambled, itagushura, itakutuka brown ni njega. So, na nginya iria, we tell people to take a glass of milk every day. So, because the cholesterol you eat contributes very little to your blood cholesterol.
Cholesterol, okay.
Cholesterol we have in our blood, 80% of it comes from the bad fats, the bad fats we use. The bad fats we use are mainly fat from animal meat, the meat from animals. Ako nĩ ta nyama ya ngũrwe, maguta ti mega. Nyama ya mbũri, na rĩu nĩ ũkuona wathiĩ mbucĩri mũndũ augaga nendire karĩa kanũru, macio maguta ti mega. With the young people, they are okay tondũ nĩmakũhota kũ-burn cholesterol, they run. Makoragwo marĩ on the walk. Koguo they can burn it, but after a certain age, 30 years, wandĩkirwo wĩra ofici, you can't keep on walking. So, the fat we eat, kũndũ gahoro wa maguta ma nyama. Then, ako nĩ ngũkũ, makoragwo marĩ on the skin, koguo mũndũ agakĩruta. Then, the other one is cooking oil. We have bad cooking oil and healthy cooking oil. Healthy cooking oil, na rĩu nĩtũthomithagia andũ tũkamera mwathiĩ mũndũ arore cuba ya maguta ĩrĩa arora ĩna kĩ, nĩ ũkuona tũnyamũ twandĩkĩtwo total fat, saturated fat, unsaturated fat. No tũtikwenda mũrore maũndũ maingĩ, look at saturated fat, maigana atĩa. Most of those oils ikoragwo irĩ na 100 grams ya oil. Koguo angĩkorwo that saturated fat is more than 20 grams, more than 20%, that oil is unhealthy for your heart. It might be healthy for other things maybe, but not healthy for your heart. So the oils, when people go to shop for their oils, makaroraga ũguo, kwa nĩ maguta maingĩ, kwanza marĩa moru makoragwo mandĩkĩtwo zero cholesterol, kana cholesterol free. Yes, for sure, they don't have cholesterol, but they have saturated fat. Iria ithondeka cholesterol when you take it. Maguta maya ma solid, ndikwenda kũweka any brands, no nĩ kũrĩ maguta ma solid, most of them are 50%. Most of them are 50%. Nyamũ ĩno twakaga mĩgate, margarine I think is not a company name.
It's not a company.
Yeah, it's just the type. It's about 30% of there, 32%. Kwa mũndũ nĩ arore, when you are buying, what are you buying? It's very important. In fact, in some, I think the government will be addressing that. In fact, we just lost the other time they said, WHO said that Kenya has not banned the trans oils. Yeah. But now what I want to tell you, when you're going to the market to buy, angalia, take some time to buy. Because once you take that time, which might be 10 minutes or so when you're buying the first time, you know what the oil you want to buy. That is the one you'll be buying all through.
All through.
So you don't have to use more time. Lakini if you want to reduce your weight also, don't take too much. Because we have said that oil will be safe. Some of the oils you have in the market actually have 5% saturated fat, 6%, 13%. Most of those clear oils, where you can see through, they have less than 20%. Yeah, but a number of them with those containers which are yellow. But I want people to actually go and check for themselves. About 45%, 43% there. So people need to check. You just need to check before you buy. What are you buying? Yeah, if it's the one which is solid, check for yourself.
Check first.
Yeah, because me, I'm not advertising, I'm just saying science.
That I'll have to go and check. Now that's on cholesterol.
Yeah, cholesterol.
Yeah.
Then now for the food, we talk of a healthy diet. Diabetic diet is a healthy diet. So we should be eaten by everybody, not just the diabetics. Because when you're on tablet, you eat a healthy diet. Yeah, but when ikiwa uko na sindano ile ya insulin, that one you need a special diet. But when you're on tablet, you eat a healthy diet. Yeah, so here we have the carbohydrates. The carbohydrates are the ones you're going to watch. We have the slowly digested carbohydrates, the moderate digested carbohydrate, na iria very fast digested carbohydrate. So iria slowly digested ni njega tondu blood sugar iko rise kidogo na slowly. So the body can cope with that. Na ici nĩ ta ndũma, mboco mĩthemba mĩingĩ, kamande, chickpeas, ndengũ, njahĩ, njũgũ, icio ũguo. They are good, they are healthy. And you know, they are also protein food.
Those are protein.
Food, yeah. Yeah. Then we have onairia.
Milk,
Milk is also in that, it's slowly digested. Na nĩkĩo icio mũndũ arĩ kũrĩa ndahũtaga na ihenya mũno. Koguo nĩ ĩteithagia nginya mũndũ a lose weight, tondũ ndũgĩkĩrĩa. Alafu rĩu iria harĩ moderately digested, icio nĩ ngwacĩ, marigũ, mũgate wa brown, mũtu wa ngima ya brown, mũcere wa brown, those ones are average. So icio tunasema reduce, and then you can replace them with the ones which are slowly digested. So if you are eating two chapatis, you eat one. But remember the chapatis, iturugwo na maguta marĩa healthy.
The healthy, yeah.
Yes. Then we have the very fast digested food. Those ones ni kama kulamba glucose. Like na glucose.
Hiyo ni ingia kwa mwili direct.
Direct. Mũcere wa white. Mũcere wa white. Mũcere wa white. Mũgate wa white. Waru cia mũkimo. Waru ngime. These ones are food to be avoided because they are digested very, very fast. The insulin goes up. Nũndũ wa cukari ũcio ũrĩa wagĩthiĩ igũrũ. And actually sometimes you take history from andũ arĩa mena cukari ũguo, that might have contributed because they make the insulin go up, then the kidney also, the pancreas igakĩruta insulin nyingĩ ũguo, it gets fatigued, so it's up kĩrĩa. Na nĩ ũndũ wa nginya ũrĩa iradigestwo na ihenya, they also lead to mwĩrĩ ũgakorwo ũrĩ resistant harĩ insulin. So these are foods to be avoided. No, irio icio ũngĩciĩkĩra the slowly digested food, tũgĩkĩre mboco, coke wĩkĩre nyeni nyingĩ, they become better. Now, mũtu wa ngima na icio ngĩndoga wa brown, tondũ ũcio nĩ whole grain, nĩ whole grain. Ũngĩtara ta mbembe itinĩtio into two, nĩ harĩ handũ wonaga yellow.
Kapatikani.
Yellow. Alafu karĩ part ingĩ ya white na ĩrĩ na skin ya igũrũ. Kwa mũtu ũrĩa grade 1 ũkoragwo ũrutĩrwo gapati kau ka yellow, na gapati kau ka yellow nĩko gakoragwo na maguta, na gakoragwo na some proteins, na gakoragwo na minerals, gakoragwo karutĩtwo, na gacoka karutwo fiber ĩno ya igũrũ, kĩrĩa skin ĩno ya igũrũ. Koguo ũgathĩĩrwo ĩyo ya gatagatĩ, which is mainly just starch. Itarĩ na minerals nyingĩ, itarĩ na protein, itarĩ na maguta. They have to remove the oil kau karĩ hau gatagatĩ-inĩ nĩkũ improve shelf life. That is why mũtu no wĩkĩre maybe mĩeri 9 ũrĩ nduka-inĩ. No ũngĩkorwo nĩ mũtu waku ũteithirie whole grain, it stays for about 1 to 3 months.
True.
But you need to keep it in the fridge nĩkĩo tige kũrũra, tondũ it tastes rancid. Kũgagata ũguo kidogo nũndũ wa gũthũka, nũndũ wa karĩa kanyamũ kau kayo ga thĩinĩ, which is the same case with the wheat na rice. So but now we are missing the fiber. Koguo that food will be digested very fast. Alafu mũndũ akĩhuta na ihenya, na nginya ũhoro wa gũthiĩ toilet ũgakoragwo ũrĩ na problem tondũ na fiber. Yeah. So what we have been encouraging people is andũ marĩe whole grain. Mũndũ nĩ athiĩthĩithĩrie mũtu. Nĩathiĩthĩe gĩthĩi. You get something healthy. Handũ ha kũrĩa starch theri.
True. Wow. Yeah. Wow. Now I see the importance.
You know, these are simple things. Our grandmothers, that's what they used to do.
True.
Yes. But no, now with being more elite, we go also for the one which is looking white.
Yeah.
The one which is whole grain will not look white.
Yeah. True,
and so that's why it's removed. One, to improve the shelf life, to make it smooth, and to make it white. You know, before, ona mutu wa ngima watu, ruraya, they use it for baking. So the
mutu wa
cake,
ngima
they use the corn flour
for baking.
For baking, ndio matikiruga ngima.
Ngima kowe.
Yeah, koguo for baking na wagano for baking cakes.
Yeah.
And with those cakes you need smooth unga.
Yeah.
But no, as we are using it for a different purpose. So I think the message is akorwo mundu niwakiria ngima best wakinya miaka fulani thiwe ithithirie mutu waku nikio nginya nda igaikarwo ikarite wega. Yes.
Wow. Hey, that's preventive. Umenifungua macho, vitu nimekuwa nikiambiwa naona yenyewe.
Na alafu nikio tutikwenda mundu akiria indo maguta maingi muno. So according to mandathi, chipsi, mundu ni tiye kuria maguta maingi muno, sausage, mundu wa maguta macio, especially when you want to reduce the weight.
The weight, yeah.
Lakini vegetables watu wakulia, especially the leafy, the green leafy vegetables, hata managu, terere, watu wakule hiyo. In fact, half of your plate should be nyeni na matunda. Yes.
Half.
Nyeni na matunda. Half of your plate.
That means protein na carbohydrates inakuwa quarter.
Good, exactly. Good.
Okay. Nice. Sawa. You're very nice. Haya, ngurie kiuria kingi hari mundu uranjuritie atiriri kuhiuha maguru ri because thaici ni twendekera mirire tumeanguka kabisa. That's true. Kuhiuha maguru no ikorwo iri cause inaweza kuwa it's diabetic, is any other inakuja correlate na diabetes?
Yes. In fact, that is one of the signs they are diabetic foot. So for that person, it's very important to one daktari nikio examine wega because that burning sensation is one of the early signs of diabetic foot.
Burning, and then he was explaining that burning, and then when he places the foot down, he feels a little inch and a little pain somehow.
Yes. I haven't seen him. I've not examined him.
Yeah. But
kaige the diabetic foot, when there's injury to the nerves, she have the foot. Koro uthiaga ta claw shaped. Uthiaga in a way that you are stepping with the toes and the heel. Okay. So you are bearing weight in the wrong places.
Okay.
Na kuniko ukrogina na ulcers. Niko kwa baadhi ya ulcers. So I think for that person it's important to onekana ni daktari. So they can check whether they can advise what to do, but it's important they be seen because those are the early signs, that burning sensation.
Right. Okay, so I'll make sure.
But for the others who do not have burning sensation, and even for that one, let's control our sugars using HB1C test.
Using?
HB1C test. Ile chukadiro tutima wa mieri 3.
Ugathigwa thimo mieri 3.
Uyu wa kara na tupoteza. Uyu wa kara uthimagwo random. Ate kaniurite, kadurite. Kanihigo wokira, kanihigo ukomete. It is not helpful. We are wasting the government money. To do community health workers, they have those community health promoters, they have those. Now we need a policy that we should only be taking fasting blood sugar. Tigane modo, uronikane murwaru, modo in a science, that one we take. But those ones probably will be in the ward. No, I can't follow up here, clinic here, outpatient. Let's take fasting blood sugar or HB1C. Yes.
Mundu to icio ungimutariria what ioni gani
wakuje. I think people let them come to our Mwangaza clinic. That clinic we are just specialists of hypertension, diabetes. Hypertension, diabetes. We do not see any other illnesses, and this is because these are the two big illnesses, diseases in Nyeri. There are 3: cancer, diabetes, but now diabetes and hypertension, they are also easier to prevent than cancer. Cancer, you need big investment. So this other one, even when I go to churches, I go to many churches to talk about it. You can talk about it without even people using any money, and they are able to follow the diet, able to do exercise, able to use the right oil. And with people like you, we can do a lot in spreading this gospel to people.
Yeah.
Because they are lifestyle. So the treatment is lifestyle.
It's lifestyle.
It's a lifestyle disease. So the treatment is lifestyle.
Okay. Haya. We need to have a better lifestyle. Haya. Now, in finishing.
I need to go.
Yeah. Talk now, last word to someone who is watching, na mpatie information, na pia utuambie Mwangaza tutaipata wapi.
Okay. Thank you very much.
Thank you.
Now, thank you very much, Michael.
Yeah.
Mwangaza Wellness and Medical Center is for well people, because we are preventing an illness. You need to come when you are well. That is why we go to churches to preach about this gospel.
Yeah.
Because churches is where you're going to get well people. If you are only going to the health centers to talk about it, you get now people who are diabetic. So we go to both places. We go to health centers to teach people. We also go to churches so that we get well people and also people who are who have diabetes. Now, during this time, from June to November 14th, we have Mwangaza Diabetic Campaign.
Mwangaza Diabetic Campaign.
Yes. From
June to
November 14th. November 14th is when we have our World Diabetes Day. And you want to talk about diabetes. I drive all the way from Nairobi to go to a church for a 2-hour talk about diabetes. And I'm not going to get tired, even if it means every week.
Please don't.
I've already told my CWA, I'm a CWA member, I've told her, if you don't find me during the meetings, I'm on this mission. Yeah. I have said up to November, with your support, with everybody's support, we need to let people know what they should do, because this is lifestyle disease, so the treatment is lifestyle.
It's lifestyle.
You can never manage, even in the developed country, diabetes cannot be managed just by drugs alone. It requires a battle, a clinical battle. Lifestyle, number one.
Yeah.
Drugs and frequent monitoring. 3. You cannot manage without lifestyle.
Yeah.
No.
You cannot.
No. So that is the message you want to give people.
Niko na wewe kwa hii.
Tukazane. November we'll say either we give up or we succeed. There are only 2 options.
2 options.
Only 2. Yeah. We don't have 3.
And you're not giving up.
I'm not giving up.
Thank you.
I'm not giving up. This is a gift I'm giving to Nyeri County, my people. It's a tribute to my dad, because he passed before I became a doctor. I had not even joined medical school, but he knew I was going to medical school. But he did not live to see me what I became. And so I thought, how can I give back? He used to like serving the community a lot. And that's why I said, I went to Nyeri County, I asked them, how can we work together? They told me, sort as diabetes, hypertension. So it's not that it's something, I said this is what I'm going to do, but I looked at the need of the people. Yeah. It's not like the books I've written in pediatrics. Those ones, I did it because that's what I needed to do as me. Yeah. This, I'm listening to the voices on the ground. What do people need?
That's what they need.
That's what they need. And that's what now I've come to like. And as a kidney specialist, I'm protecting the kidneys. Yeah? I'm also here to protect the kidneys. Because this disease, they affect the kidney. So I'm also fulfilling my duty as a kidney specialist. Yeah.
Nitawalk na wewe kwa hii barabara in case.
So Mwangaza, we are at, it's in Karatina, is in Kemwangi, and it's at Jabo Junction on your way to Karatina University. It's just 1 mile from Karatina Nairobi Road. Okay. Just 1 mile from Karatina Nairobi Road. Okay. We are also on the website. We have our website. Yeah. We have our Facebook. We have a Facebook page.
What's the page called?
Yeah, in fact, I'll tell you.
Okay, so I'll put it down.
Yes,
yeah?
Yes.
Yeah. So thank you for your time. And asante sana.
Thank you.